Hi, I'm Dr. Denise Milne, Executive Director of the Alberta Continuing Care Association. Thank you for joining us for today's important discussion where we'll be exploring innovative ways to enhance navigation and coordination within Alberta's continuing care system. Navigating the complexities of continuing care can be overwhelming. Patients and families often face fragmented pathways, inconsistent coordination, and administrative hurdles that create stress and lead to delays or gaps in care. Care providers, too, grapple with these challenges, which can complicate service delivery and strain already stretched resources. By addressing these systemic issues, we can improve health outcomes, reduce pressures, and align with government priorities. For caregivers, this means easing the uncertainty, anxiety, and frustration they feel while supporting their loved ones. To help us tackle these challenges, we're thrilled to welcome two incredible guests. John Prey from Suitebird brings nearly 3 decades of experience in senior housing and the care field, offering personalized navigation services that connect families with tailored housing options, amplifying transitions, and enhancing patient outcomes. Kevin Jones from Strata Health is also joining us today. In 2023, Kevin was honored as the Digital Health Executive of the Year by Digital Health Canada, recognizing his leadership and contributions to the field. Kevin currently serves as Senior Vice President at Strata Health, President of the Alberta Health Information Exchange, and Chair of the Alberta Chapter of Digital Health Canada, where he continues to champion advancement in health technology and interoperability. We would also like to extend our thanks to Strata Health Solutions for sponsoring this episode. With 20 years of experience in the health technology sector, Strata Health is the leading provider of intelligent digital tools for resource allocation, patient transitions, and patient flow innovation across the care continuum. Strata Health supports healthcare clients on 3 continents, helping over 12 million patients worldwide to get the care they need faster. Strata's software solutions have improved the healthcare experience for patients, clinicians, and health jurisdictions worldwide. Now let's dive into our discussion. So John, can you share with us, and like our many listeners, with your journey with Suitebird? What is Suitebird? How you became critical to Suitebird?
Sure. I spent almost 35 years in seniors housing and care in Alberta, and enjoyed my time in that career. My last sort of position was as CEO at Shepherd's Care Foundation for just over 18 years. During that journey, I spent almost every year as part of ACCA once I got into long-term care. So I was pretty connected to the sector. But I also seemed to spend a lot of time, even as CEO, fielding calls from families and friends, and actually even people within the sector that a little bit stressed out when it's time for mom or dad to find either a seniors housing facility or some type of continuing care. And I was also aware of an organization in the United States that was getting bigger and bigger, called A Place for Mom, that was helping families place a loved one. So I think in the back of my mind, I kind of put both together and thought, it might be something after retirement that you could do some good and help families, and maybe it would be sort of like a business model. So we started Suitebird in February of 2023. And the main focus that we wanted to work on were sort of 3 principles with it that we thought would be most effective and helpful. And that was that it would be simple to use. There are some, sort of web-based or programs that you can go in and select what you want, but they tend to be a lot of questions to answer.
Yeah.
And so we've kept the form simple. And just basically, the most important things is what type of housing or care do you need and where do you want it, and what your budget might be looking at. And then tell us a little bit about yourself, so you can sort of match those preferences with the community that may meet those preferences and locations. So we tried to keep it simple.
Hmm.
We tried to keep it local. So to start off, we're focusing on Edmonton only. So we
Hmm.
have had some calls, for Calgary and that, but we thought, well, let's really, really be good locally. So
Hmm.
one of the things that happened during the journey is I phoned a couple other sort of similar services to find that the person was quite a ways away, even in another country, and trying to provide advice and direction in a locale that I don't even think they knew where it was at. So, so simple and local. And then the third thing, probably the most important thing, is we wanted it to be personal.
Hmm.
So when you either log in or I should say, visit the web and go to fill out the questionnaire, you get a call right away from a navigator. And being a startup, that navigator has been me.
Hmm.
And so you know the Edmonton market, and you know the operators as well. So you can provide that sort of input. So the key has been one, simple, two, that it's been local, and three, that it's been personal.
Which has been truly, I think, that is the success behind a proper, what I'm going to call an access, connection, transition system for individuals, but you have that personal touch. So, John, why the name Sweetbird? I've often wondered, like, what's behind that?
So we were looking for something that was simple and unique.
Yeah.
To be honest, we had Homebird as the first choice, right? So got all excited about that, but found out, once you do your search, like this is the first time I've ever done a startup, right?
Okay.
So you did the search and find there were some other Homebirds. I think they were selling blinds or something in another city or something. So we thought, well, we better concentrate on something that's a little bit different, but keeps the bird aspect. And we've been saying find your next nest, that type of
Yeah.
thing. So I think it's just finding really bright people that specialize in that naming or that marketing thing. So we had a tremendous young marketing team, so they did a good job. I think it's a name that I think you want something that grows, and it
Hmm.
seems to grow on people. So
Hmm. It absolutely has done that.
yeah.
So from your perspective, John, what have been the learnings in terms of what I keep referring to and you refer to as the human touch perspective with families contacting you? I know
Right.
that I had a lady call me from BC because they were going to move from BC into southern Alberta. She wanted to have her dad leave long-term care in BC and come over to Lethbridge. That was the area they were going to, long-term care. I hooked her up with you and one of our board
Mhm.
members, and I got the most beautiful letter from her
Yeah.
appreciating that human connection. So can you explain to us how important that is, what's behind it, the difference it makes?
Yeah. So I would say the biggest thing that number one is it sort of takes that stress away when they've got someone that, shows that they care and that they are willing to help them on the journey. I think you relieve stress almost right away. Like I can even feel it on the phone when I talk to people, right? You can feel sort of, I won't call it panic, but just
Yeah.
really worry. And sometimes we get people that need to find a place in 30 days, right? That's sort of been on the side, that's sort of been a trend where I don't know whether it's condominiums that are or places that are getting out of condominiums or whatever, but it just seems like we've had more people looking for a place within 30 days that the landlord's not renewing the lease. But it's sort of helping them out with that stress thing. And then the second piece is, and I've been around where we've tried to get the name right for all the different types of care.
Hmm.
I mean, when I started out, it was Alberta Long-Term Care Association, became Alberta Continuing Care Association. We had designated assisted living, we had supportive living. We're continually changing, and I think the direction's right to try to simplify it.
Hmm.
But what I find, no matter how hard you try to simplify it, you just have to slow down and explain it as simple, even more simple than what they see on the uh, on papers or brochures or that sort of thing. So Um, I did that during my career too. I always thought, the easiest thing to do is just really simplify it, right?
Hmm. Well, and you're correct, because now we call them care homes A, B, and C, and then
Right.
you have to look into, well, what does A mean, what does B mean, and
Yeah.
what does C mean? And we do need to educate Albertans
Yeah.
about, based on the Continuing Care Act and the changes from that, what this all means, because at the end of the day, they're looking for the best place for their loved one.
Yeah.
Yeah.
And, over the years, I would say, and I actually had a couple sort of families that I was talking directly with the case manager. This was more of like a home care thing. And then over the years, I saw this too. And I would say, I mean, it's probably like that in all um, healthcare, right? But it's really sometimes you get a caseworker or a social worker that is extremely helpful. And most times you get someone that it's just the facts, right? I'm
Yeah.
just going to tell you. And then one of the biggest things I hear, especially on the continuing care side, is here's the list, go find a place.
Yeah.
Hmm.
I
Which,
mean, that just adds to the stress of
yeah.
trying to figure out what to do with mom or dad.
Yeah, and you're right. Sometimes there's these timelines people have to meet, overwhelmed by just the whole situation of trying to support their loved one in a transition process, hoping they're going to end up closer to their home so they can visit. Like there's so many factors in terms of where people move to and are they
Yeah,
going to have the right wraparound supports, because many of everybody's adult children are working and they're busy. Yeah.
correct. Very, very.
Okay, thank you, John. We're going to flip over to Kevin. So, Kevin, can you tell us about um, the sponsor of this episode, Strata Health, and the role your company has played with system navigation in Alberta?
Yeah, of course. Thanks, Denise. Alberta's actually home for us. This is where Strata Health started back when there was a Calgary Health region before there was an Alberta Health Services, and now, of course, the refocus onto the 4 pillars. Our objective was really to help streamline that transition of care. We know the system's under a huge amount of pressure right now.
Yep.
And what we're trying to do is give some transparency into where vacancies are available, to try and create some consistency and transparency around what wait lists look like and optimize that. So for the past 20 years, we've been the vehicle with which people are placed into publicly funded long-term care homes. And I think the upcoming changes represent a huge opportunity to bring it beyond just the back end clinical focused and drive some patient focus into that. And I really love that we kicked off with John and started talking about some of that human touch, because I think it's so important when we talk about leveraging technology to help with the system, because technology doesn't replace people. What technology should be doing is making it easier for people. It should be providing the tools that not just patients, but navigators are able to use to enable appropriate placement. It should provide data and information that can help drive decision making, that can help people understand that, even this home might be the place they want to go, but how much longer are they going to have to wait if they go there? And might this be a better option if they're under that 30-day time crunch to know where they can end up?
Great, thank you for that. So, Strata Health has been supporting AHS continuing care, correct? Like you have sort of a platform that aids case managers, caseworkers in Alberta Health Services continuing care to move people into where there's vacancies, right?
So we do a couple of things
Yeah.
very specifically. The first is if you are a long-term care home of any of the supported living levels, or palliative care, or any of the bed-based services, then you provide your vacancy availability through our technology to the folks who work in the continuing care space. The clients who have been waitlisted and are under the publicly funded regime all end up within our technology. So we're managing the wait list on one side of things, we're managing the bed vacancy on the other, and then we're supporting those people in matching a specific client from a wait list to a bed based on their care needs. And interestingly, one of the ways we do that is by understanding for the long-term care homes what services they're able to provide. And what that should do is actually enable a service like John's to say, if you have a patient with some specific care needs, what long-term care homes might be appropriate. I think one of the challenges we have is that knowledge. And John, you talked a little bit about that. You know the Edmonton zone. So if you're the navigator, that's fine. You can easily speak to somebody. But as we move to other areas of the province, you need a navigator with some expertise. So if we can use technology to help provide some of that expertise, all of a sudden we open up capacity for people to be able to really help patients through their journey.
Well, and your technology, if you take John as a navigator with the human touch, it helps him access availability quicker than making calls to different facilities or whatever steps need to be taken for that individual. And he can tap into that. And now he's zoning in or filtering in based on his experience and expertise to best support that loved one.
Yeah.
Yeah. Okay.
100%. I think
so there's
one
the
of the
match.
other one of the other aspects to think about on this is that we currently don't have any private availability. So the public system and the private system are completely divorced right now.
And they need to be married because that's patient option, patient choice, caregiver options and choices that are best going to support their loved one so they can see the array based on the resources they have. Yeah. That's a really good point about trying to pull that together.
Yeah.
So,
I think, just after I started, right, you think a logical thing was if you look at AHS, for example, right, and they've got people needing to find a long-term care space, but let's say they're a couple and they're looking for a place that has both apartments and then the loved one can move to long-term care. So I tried right from the start, and I've known AHS since it started, right, to say, could you in your brochures, or even as they talk to people, if you could say, if you're looking for a place that also includes housing, here's an agency that, for free can suggest somewhere. No interest at all to even suggest that to families that may be struggling, right? So it kind of shows that, it is kind of a cold system, right? That, here's the list and, but you're really sort of on your own, right?
yeah.
Well, there's a bit of a stigma we have in the public healthcare system about marrying that public and private together. We're quite proud of our public system, which I believe we all should be very proud of our public system. But at the same time, we don't seem to want to say, hey, there is a private side, and that private side actually has a place in ensuring we all get quality healthcare.
So, John, with all your experience in continuing care, what are your thoughts on how, like, the marriage of public and private, like, to build sort of a menu of options for Albertans?
Yeah. Well, I would say, this has been a real learning experience the last few months for me, right? Getting to meet Kevin and that. And honestly, I thought at the start, I said, we just need to add the personal touch to what's already there. But I would say at the same, adding the personal touch, there's also ways to make the technology piece even better. And, getting to know Kevin and that and a little bit more about what they're doing. I think there's actually improvements on that side as well. So it's kind of marrying both of them. But I think, like I had talked with the government before, that they have done better jobs, especially on their websites and where to go for information, right? But, I've mentioned to them, it could be something as simple as just adding a person that you could phone or chat or whatever if you had questions about what you see in front of you. And it's the same thing too. There's a couple other websites with other organizations that, they're providing the list of the places to go. But again, you're really on your own as far as, if you need further information. I know Alberta Seniors over the years has done a really, really good job with Alberta Seniors Benefit. And that's a really big deal for seniors, right? Like it's really important. And a lot of people don't realize you get a bit of a top up if your loved one moves on to long-term care. But I know they did a really good job with like the operators that take the calls and that sort of stuff. So, I mean, for me, that shows like it can be done. It's just almost like you just need this, you just need to realize that there's an issue and how can we sort of add customer service or personal to what we're already doing.
So instead of an 811 system, we need a 711 system with
Yeah,
educated,
you
trained
could.
navigators that talk with
Yeah,
people who have
yeah,
these questions and concerns with the foundation of a computerized system of availability of all
yeah,
the many options, bridging human touch to technology, private with public.
yeah.
Yeah.
And, I mean, dream a bit and just imagine how easy it would be to provide other information about, I don't know, you need help with medical supplies, or you want to know more about the program to adapt your house or whatever, right? So,
Yeah, like ADL. And how do you apply and helping
yeah,
that person fill out the application because it gets really complex, right?
yeah,
And some people don't even have computers, right? And
yeah,
so how do we help people, make it more simple, less stressful to get them where they need to be? Yeah. I'm
exactly.
going to call it the 711 system. I don't think it's taken yet. But you think of
Hey,
811 and having a trained nurse
yeah,
who knows the healthcare system to guide you. It's very
yeah,
similar to that, but with knowledgeable, experienced, trained people, and that are bridged into a foundation of a computerized system where they can
right.
see what's
Yeah,
available, not available, what's available in that site versus that site based on the needs. Yeah.
yeah. Never thought. Good idea.
Yeah, it's not really that complex actually, but
No,
somehow we
I
make
think
it
that's the
complex.
point. Exactly.
Yeah.
Well, I think we talk about this a lot in the technology space, and it's an 80-20 rule where if you can simplify the 80% of things, then you can free up a lot of capacity to help with the 20% of things. And if I think about, your 711 service that you're talking about, there are going to be people who are capable and want to just follow a flow through that says, I'm happy to read what the various levels of continuing care are and look into them and see what the wait times look like and make my choices and move on. And it's maybe not 80-20. I'm probably got those percentages wrong. But then we need for those people who this is actually very overwhelming and they don't know what to do and they're not sure what all of this means. And these applications are very challenging to have somebody to navigate through that. So I think for me, an important aspect of this is to enable technology and enable people at the same time at varying levels that varying people want to make, it's almost a concierge service of sorts.
Right.
Yeah, and I see continuing care as a very, it's a specialized field. Um, and so I'm a really a strong proponent that the navigator, there needs to be a personal touch navigator that is trained and understands the system, has some experience in the system to better support versus calling a general line with people that may not have an understanding of continuing care and all its complexities or uniqueness. They need to be able to, be very welcoming and supportive on the phone, but the guidance requires that trained perspective. Is that not so, John?
Oh, very much so. Yeah.
Yeah.
Like I would say lots of training.
Yeah.
Okay, I was just thinking during my time, for example, when I was at Shepherd's Care, right, we were a multi-level, we kept couples together because you had the apartments that, but a couple of things, location's always important, but one of the things is being a faith-based organization, quite often you would meet a family where that piece of it, the spiritual piece, is really important. But if you look at the first bed policy and the direction and all that sort of stuff, we used to have to really work hard working with case coordinators that to make them realize that that was important to the person, right?
Yep.
So I'm not so sure how much we've improved the person-centeredness of placement, right? Like I think there's lots of well, and then you feel the frustrations of the people that have to take the first opening, right? They have to, and very seldom are there people that are 100% satisfied with their first choice. So, again, it speaks to the personal part of it, right?
Yeah.
That
So
we don't look at that person that's being placed.
yeah, so John, can you explain a little bit more to that for our audience? Why you have to take the first choice? You can't
Yeah.
not take it, and what
Yeah.
happens?
Yeah, so I've been retired, but I think it's still this way, right? Where once it's determined that that's the best place for a loved one, then they're offered three places. Well, they're offered a list where they can go and phone around and see if there's availability at any or of interest, and then they're told that whatever bed comes available first. And I've said this to families before too, right? If you're on that list where you need to take the first bed, it really signals that your parent really does need a long-term care space, let's say. So you should realize that, but you should work with your caseworker in that to say that, but our preferred place is over here on the south side or something like that, right? So you work with sort of the case coordinator, but so I guess that's how I would explain it, right? I'm not so sure others would explain it that way to the family. So again, back to this stress piece, right? That I got to get my dad out of hospital. He's got to take this first bed. I don't know anything about it. And again, a personal navigator, let's say, or someone could sort of at least put them at ease and educate them about the system and about the first bed and all that.
So it's interesting. There are some first available bed policies of varying interpretation around the Canadian market, and each of the provinces tends to operate a little differently, and it tends to be interpreted potentially even differently depending on where you are in a given province, depending on how it's set up. We, of course, through this technology, have to be able to support the first available bed. So, we track what preferences people want to go to. Most often now, what we're seeing is people will go to one of their top three, or sometimes it's five, or some provinces even have 10. One of those preferences. And then if your urgency gets high enough, or you are long enough in an acute care center where they feel like you're really unsafe in that location, then you'll end up being placed in, the first bed that comes available that could meet your needs. And then the intent is to flip you onto a transfer list for one of your preferred. But with the pressure the system's under, it becomes very difficult to engage those transfer lists. So one of the things we've seen in some of the provinces is they start to implement ratios within their beds to say, we'll make sure every third bed goes to a transfer client, to really honor the fact that they've tried to give people choice. I think the piece we're missing a little bit in this is that this is a big journey for somebody.
Yes.
That moving into a long-term care home is moving your home, is potentially changing your community. And so that's, for me, why I think it's so important to start to open up some of these private choices and to take a look at some of the different funding models so that we can really enable people's choice and really honor the fact that these are people, not patients.
Yeah.
Yeah, because
I was just thinking that's pretty interesting. That I would say there was a time where there used to be more collaboration, let's say with government and with private and with public, right? So first bed is another good example, right? First bed, I don't recall any involvement of operators or organizations talking with any level of government about how you could make a first bed policy more person-centered, or how you can make it work. It was really dictated down. And I think, Kevin probably knows a lot more than I do about how many sort of government directions like that are, it looks good on paper type of thing, but there's just and then there's no means to kind of improve it.
Well, and I see if we could get to really fulfilling this vision, where I'll just call it the patient navigator, helps with the onboarding process with the facility or wherever that individual's hoping to go to, and sort of works with the family around that transition, because transition can be so complicated. and so difficult and so stressful. So you finally have something, and now your father or mom's going to be transitioned into a long-term care facility or supportive living, and there's a whole journey there, and there's a lot of emotions there, and then they get to that place, but maybe it's too far away, so they're going to move them again. Like, the pressure on that individual moving through various systems, because they're just starting to maybe make some friends, do some social things, and boom, they're moved because they need to be moved to some place closer to their home community. Like, there's got to be a better way of mapping this out for the Albertan in the system with their caregivers, with the support of, skilled navigators in continuing care, with a proper foundation of digital.
That's interesting. I think, we're seeing a lot of movement towards trying to push more placement out of community versus out of acute care. I think the challenge occurs when you have people in acute and they're very unsafe.
Yep.
So now you're talking about trying to move someone from an unsafe environment into a more safe environment, which that's when you can start to make a first available bed make sense a little bit in your mind, because, hey, you're at least, you're trying to keep somebody alive here. And the acute care is not a great place for seniors. I don't think anybody would disagree with me there.
Yeah.
And so I love this push in the community, and I think enabling people's journey from the community to be a bit more seamless and a little bit easier, and to include better navigation, can start to keep people out of acute care. I think the big challenge is, how do you staff it? How do you resource it? We're in an HRR crisis right now. Maybe we're starting to come out of it a little bit, or maybe we aren't, depending on who you talk to. And so that's why I love, and again, we keep coming back on the same theme, this idea of marrying technology with people, so that you can enable people to do more, and potentially be able to support that kind of model.
We could talk about this for hours, but I don't think it's as complex as people think it is. And John, and I think, Kevin, you agree with me. Like, it's a matter of, let's just get going. Let's marry this up, bring in the right players, bring in the voices of, Albertans and their caregivers. Like, this is such a needed piece in the system, particularly in continuing care. I would love to see this followed through. Yeah.
For sure.
So I want to thank you both for joining me today. This conversation highlights the importance of effective navigation and achieving better health outcomes, both for the individual and the system, and then reducing system pressures, but also pressures on the caregivers and the individuals moving in the system in continuing care. Your insight and expertise will inform recommendations we provide to the Government of Alberta, ensuring that our collective voice reflects the needs of patients, families, caregivers throughout the province. I want to thank you again for partnering with us on our member meet and on this podcast. We appreciate your commitment to revisioning the system to make it better for Albertans. So to our listeners, if you enjoyed this episode, we would greatly appreciate if you would leave us a like or a comment on the website. It helps us reach more listeners and allows us to continue having these important conversations. Thank you for listening to the Long-Term Forecast.